Over-the-counter laxatives. If lifestyle changes do not work, over-the-counter laxatives are an alternative for constipation treatment. Stool softeners, bulk-forming laxatives, and Miralax, polyethylene glycol, are gentler on the body but take longer to function. Stimulant and saline laxatives are more effective, although they can produce stomach pain. If you have constipation that lasts more than a week, or if you have symptoms such as vomiting, blood in your stool, or severe abdominal cramps, see your healthcare professional. Constipation can be aggravating and unpleasant. And if you're constipated, you undoubtedly want relief right now. So knowing how long different laxatives take to work is useful. Some laxatives work faster than others, and while this can be beneficial, it does come with some drawbacks. Let's look at the many over-the-counter, OTC, laxatives available to you. What exactly are laxatives? Laxatives are a class of drugs used to relieve constipation. They are available in a variety of OTC brand name and generic products. They also come in a variety of forms, including oral, tablets, capsules, and liquids, and rectal, enemas and suppositories. Each type of laxative works in a different way to assist you in having a bowel movement. This means that they may each require a different length of time to complete. Depending on the type, OTC laxatives might bring relief in 1 to 3 days. Furthermore, some goods may not be the ideal option for everyone. When should you take a laxative? You may be constipated if you have bowel movements less than 3 times a week. Before taking a laxative, it is usually recommended to try changing your lifestyle choices to help with constipation. This can include things like increasing your fiber intake, consuming more water, and exercising on a regular basis. If these modifications do not alleviate your constipation, it may be time to try an over-the-counter laxative. Some laxatives are more effective than others. However, the laxative you choose may be influenced by a number of different circumstances. These include whether you want to take it orally or rectal, whether you're taking any other prescriptions, and whether you have any underlying health problems. Pros. Rectal laxatives have a rapid effect. They may also be beneficial for people who have trouble swallowing. Another benefit of these drugs is that formulations are available for both adults and children aged 2 and up. Cons. The rapid onset of these laxatives has a drawback. They frequently cause stomach cramps and diarrhea. They may also irritate the rectum. Rectal products are often more difficult or uncomfortable for some people to use than oral medications. Squeezing fluids into the rectum is required for enemas. Suppositories, which are usually solid and bullet-shaped, must also be inserted correctly for them to operate. Saline enemas may not be the ideal option for people who are trying to reduce their sodium consumption or have kidney or cardiac problems. Medications designed for rectal use can be hazardous if unintentionally eaten, so only use them as indicated and keep them safely stored. Within hours, you will feel better. Mineral oil, saline laxatives, such as magnesium hydroxide and magnesium citrate, and stimulant laxatives, such as bisacodyl and senapils, are the most effective oral laxatives. Milk of magnesia, Dulcolax, and Cinocot are examples of OTC products in this category. The benefits of these laxatives are that they usually work in less than 12 hours. They're also taken orally, which is more convenient for most individuals. Most of these laxatives can be taken by both adults and children. Cons. Oral laxatives, like rectally administered laxatives, can produce cramping and diarrhea. Oral saline laxatives, such as magnesium hydroxide and magnesium citrate, can interfere with the absorption of some drugs. They may also be unsuitable for people who have kidney problems. Bisacodyl should not be used within an hour after consuming milk or antacids. Mineral oil taken orally can be harmful for people who have difficulty swallowing. This is due to reports of it causing pneumonia if inadvertently inhaled into the lungs. Fast-acting oral laxatives are likewise not recommended as first-line treatments for constipation relief when pregnant. If you're taking other drugs, have trouble swallowing, or are pregnant, consult with your pharmacist or healthcare practitioner to ensure you're using an OTC laxative that's safe for you. Within a few days, you will feel better. There are 3 kinds of laxatives that take longer to work, 12 hours to 3 days. Fibercon, stool softeners, and osmotic laxatives like Miralax are examples of these. Citracel, Metamucil, and Collis are among the more common OTC drugs in this category. Although these laxatives take longer to work, they are typically gentler and have fewer negative effects than faster-acting laxatives. Miralax is available as a powder that may be added to any beverage. It is also sold in pre-measured packets. For folks who have difficulty swallowing capsules or tablets, this may be a better solution. Stool softeners are available in capsule, tablet, and liquid formats, and there are no known drug interactions. Long-term usage of bulk-forming laxatives is generally regarded as safe. They can also help with persistent issues like irritable bowel syndrome and hemorrhoids. In most circumstances, all three of these products are also regarded as safe solutions for pregnant women and children. Cons. These laxatives typically take longer to work. Furthermore, while they have fewer negative effects than other laxatives, they might still induce bloating, gas, or cramps. If you have kidney problems, Miralax may not be the best option. And all three of these laxatives may not be suitable for those who are limiting their fluid consumption. This is due to the fact that they all require you to consume a lot of water in order for them to perform properly. Bulk-forming and osmotic laxatives may interfere with the absorption of certain drugs. If you are taking other medications and require an OTC laxative, see your healthcare professional or pharmacist. What can you do if a laxative doesn't work? If over-the-counter laxatives do not relieve your constipation, you may have a more significant problem. A gut blockage is one possibility. This occurs when anything prevents food from passing properly through your gut, and items become stuck. If this continues for an extended period of time, it might become a medical emergency, requiring surgery in some situations. Other medical disorders, such as colon or rectal cancer, could also cause difficult-to-treat constipation. If you have constipation coupled with any of the following symptoms, contact your doctor immediately. Cramping or pain in the stomach that is severe. Vomiting and nausea. Inability to expel gas. You have blood in your stool. Weight loss that was not predicted. Is it possible to overuse laxatives? Yes, it is possible to overuse laxatives. Always follow the laxative usage recommendations on the box. Most OTC laxatives advise you to consult your doctor if you need to use them for more than 7 days at a time. This is because you could have another issue causing your constipation. It's a good idea to see your healthcare professional in this scenario so they can figure out what's wrong. Overuse might cause dehydration and an electrolyte imbalance. This can aggravate heart and kidney problems. If you find yourself needing to use laxatives on a frequent basis, consult your doctor.